I hereby declare the Candioi County Board of Commissioners is now in session. Will you all please stand and say the pledge to our flag?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That was a Pavlovian response.
Yeah. Well, you're all good trained. Good morning, everyone. I'd like to welcome everyone this morning. I would like to welcome those people who are watching this on YouTube or live streaming this. We want to thank you for your interest in Candioi County government. I also like to welcome this morning the new commissioner-elect in the audience, Dale Anderson. Good to see you here, and we're looking forward to having you on board. For the record, today is Tuesday, November 15th, 2022. We have quite a variety of information and agenda items today, and our first thing to deal with would be our consent agenda. This is one of the longer consent agendas that we've had. We got 9 items on there. Commissioners, we can pull any of these items for further discussions if you wish. For those who are listening, the stuff on the items on the consent agenda involves our minutes, of course, and our warrants and bills to be paid. But this time there's also some contracts and fee settings for public health and contracts with Health and Human Services. Any questions or comments?
I just have one on the interpreting part. Is that just for one?
Do you have a short question? We can take that now. Otherwise, we can pull it and we can put it on the agenda later.
Just a short question.
Sure. Jenny?
Question, is that simply for one company, or is that?
Yes.
That
Okay.
There's 2 or more.
Okay, and I'd like to call on Candioi County Public Health and Human Services Director, Ms. Leppert. Good morning.
Good morning. What you see in front of you is just our contract with one of the providers.
Okay.
So,
But we
yep.
generally have had more than one?
We do. Yep. But this is just for
right.
one of them. Mhm.
That was my curiosity. Thank you very much.
And if I understand, this has been the first increase since 2012, is it? So it's far overdue.
Yes. Yep. We've gone a number of years with this provider, and they have not asked for an increase. So I think it is very substantial in the times that we're in that we would acknowledge this increase for them to continue their business operations.
Okay. As long as you're there, I had one question as well, if you may. Greater Minnesota Family Services contract, and we have a reduced rate because we're the host county. Is that the understanding for that?
That is correct. Yep. We have some benefits because we do host that
I figured that was the
in-county
case.
contract with them. Yep.
Any other quick questions for Ms. Lippert? Hearing none. Thank you very much for responding to that.
I will move the consent agenda.
A motion by Commissioner Nissen to approve the consent agenda. Do I have a second?
I'll second that.
A second by Commissioner Anderson. Any further comments or questions or discussion? Hearing none, I'll call for the vote. All in favor say aye.
Aye.
Aye. Opposed, same sign. Passed unanimously. Thank you very much on that. Now I'd like to move and invite Ms. Peterson from PAC 4 for Families. Good morning.
Good morning.
Good morning.
You have an update for us.
So this is our yearly update, and a lot of new things to share about, coming, I don't want to say post-COVID necessarily, but just some changes. You have in front of you some talking points, but just some of the highlights of what our partnership has been with Candioi County and across some of the other counties. But we have, I just want to highlight some exciting things. We have Talking is Teaching for quite a few years. We've had this across all 5 of our counties, but last year and into this year, we started a project with Renville County and Candioi County Public Health doing milestone boxes to encourage families to engage with their little ones, and just lots of great feedback as we've been wrapping up that project, and more interest in the other counties to really get on board and to expand this project. But they're little boxes that are geared for 6-month-old, 12-month, 18-month, And I know some of the feedback from the public health nurses has said, when you go into a home and you're trying to support families and you're trying to build trust, what they found is actually sitting on the floor with a parent and their little one, playing and talking about counting and peekaboo and a lot of things that are actually helping development with a child is really encouraging, because a lot of these families then, these little boxes just have some non-expensive little things that you can find around your house. And a lot of these parents haven't realized that they don't have to go buy a ton of toys, but that their interaction with their child is teaching them. And so just interacting. But the takeaway I took from a lot of these nurses was the trust that was built with these families. When you're coming in, they don't always necessarily know what you're there for and trust that you're coming in with helpful intentions. And it's amazing just sitting on the floor and what that can do. So that's a really encouraging project. And it was $5,000 for across the 2 counties that we gave, and have these cute little boxes and fun stuff, and a great thing that we're looking at expanding into all 5 of the counties. Social work positions, just to let you know, so we fund 25% of, 50% of one person's salary in Wilmer Public Schools, and then we have a percentage for in NLS schools and Misty Langseth in ACGC schools. So that is one thing that we've done with 9 positions across our 5 counties, but 3 right here within Candy, Ojai County. ACES calendars, I don't know how many have you commissioners seen the ACES calendars? So this was a great project that was partnered with Renville County and Candy, Ojai County. So there's a joint group, Candy, Ojai, Renville ACES Committee, but Renville County gave half of the project cost, and then Pact for Families did half of the project cost. But in Candy, Ojai County, in pre-K through 6th grade, every child went home, every household went home with a calendar. So we didn't do it to every child. We had to really work with all our schools and find out, and we sent it home with the youngest child in their backpack. We figured it was the easiest way. If they had 3 kids in a school, 1 child got that. But every child within Candy, Ojai County got one of those calendars. And then our partner schools within 5 counties got all of those as well. And so 15,000 calendars went out, and we did win a state award for that, and you can see that in your italicized there, and that has gotten a lot of attention statewide.
Is it okay to take questions during?
Yes,
Oh.
yes.
Just not even a question, just for the folks who are listening today, ACEs means,
Adverse childhood experiences. So the CDC has actually named ACEs as one of the largest public health threats that we face, it is a over 20-year study, a medical study that ties in adverse childhood experiences to long-term health effects. So we're talking heart disease, we're talking obesity, we're talking diabetes, substance abuse. To me, just and because of the world that I've worked in for the last 25 years, the amount of adverse childhood experiences tied into substance use, if we were able to get upstream a little bit on those things, the cost savings would be staggering that those are connected to. But again,
and this includes different types of trauma within the home setting.
So it was a 25-year study, because they're still following these folks. And what's interesting, it was mainly white, middle-class, educated people who had insurance is who they studied. But really the fact that if you have, the more of these adverse experiences you have, your rate of health inequities goes up. So that could be having a parent that struggled with mental health, that could be living in poverty, having a parent that was incarcerated. emotional abuse, sexual abuse in the home. So all of these things, the more a person has, the more they are tied with adverse health outcomes as they age. And so it's, people hear a lot about that, but we can hear about resiliency too. And so this calendar was really focused on those 9 categories and really talking about how you help combat those things, and had all of our county resources on there. We had talking questions on there, and we worked really, really hard to create something that was very useful and educational at the same time.
Commissioner Emdek?
Thank you.
You had a question?
Thank you, Mr. Chair. You at the risk of sidetracking you even more regarding ACEs, without listing them, how many ACEs have been identified?
So what's interesting is this has exploded. Again, this started in the 80s by 2 doctors on a brown bag lunch seminars that talked about, gosh, I work with my patients and they do really, really well, and all of a sudden they just backtrack. And then as they started talking, they realized there were so many common threads that some of their patients had. So they identified 9. This has been now replicated, and I think rightly so, in different communities when we talk about trauma. Trauma comes in all kinds of packages. So there is a pediatrician in Philadelphia, Dr. Roy Wade, who has replicated this for inner city families, because a lot of those youth witness extreme violence in their communities, their family members. And so how does that impact? And so it's been replicated with different ones. They've even now talked about COVID. How is that gonna adversely affect little ones and kids kind of coming up during that pandemic? So it's growing, the idea of really about trauma and toxic stress, that whole idea about what that does physiologically on the body over time. I mean, we all have had stress. We know stress can be good, but when you have a continual stress, so living in poverty and living with a parent who is incarcerated and not having your basic needs met and living in a community that is violent, how long-term from birth to 8, living in that environment, how does that kind of rewire, your physiological self? And then the effects are long-term. Why does somebody have high blood pressure, when they're 50? It can be traced back so much to that, and there's so much science behind it, and which is amazing because this study was done by an Kaiser Permanente Insurance, and it was a very backed survey, long-term data. We just got lots and lots of data to support it. So but now the focus is on how do you get upstream? How do you really help build resiliency and support? We know it's there. We don't need to keep saying it and naming it. We know it's there, but how do we then prevent some of these things? How do we get upstream on some of these things? So, because as we've all said, those of us working in it, it's not your destiny. We all know that there's people that have grown up in some hard times and are doing well. So what do we learn from that, and how do we support families to do well? So yeah, I'm done now after that.
Thank you.
Very
Yeah.
good.
Thank you for the
I
answer.
mean, that actually probably would be a good summary, about how do we help families do well? What can we do to help do that? So, kind of summarize, May is Mental Health Month. Our local advisory committee, we do, the state requires that each county have a local advisory committee on children's mental health. As the collaborative, we combine all 5 of our counties together and work together to do something across our 5 counties. And it's exciting because going forward, they're really talking about doing a year-long instead of, we focus a lot on May as Mental Health Month, but we're talking about maybe doing something going into the winter months and coming out of the winter months, and just really that positive messaging. I think we've all heard so much negative messaging, but how do we, support our friends and family? So they've been really working on doing positive messaging, conversation starters with your kids. How do you have conversations at the dinner table and talk about fun things. What are their goals? What are their dreams? And doing kind of a year-long approach instead of just like, oh, May is Mental Health Month, it's here, now we need to focus for 30 days, but it's all the time. So connecting families, this is one thing I think that we're really proud of, is that we have a lot of grants, and we'll talk about those, but one thing that for me that I'm passionate about, that I hope that I've brought to the collaborative, is that we cannot service ourselves out of mental health. Like, we can never hire enough social workers. I look at Jenny. We'll never have enough. We have to keep building our communities to have that capacity to take care of one another. And so I think the feedback we've received on our Connecting Families is we're bringing people together, we're bringing some resources, we're bringing some education, but we're bringing lots of families together to learn this. And then they exchange phone numbers and information, and then they know things about each other, and they know they've maybe traveled a similar path. And when they come across a bump in the road or a roadblock, they have someone they know, because I think we all know we like to talk to somebody who's had a similar experience. I trust you because I know you've been through this. What did you do? Who did you reach out to? They don't always reach out to the providers. And if we can build, again, that underlying capacity for connecting our families together, I think we do better in many ways. So that goes on to our TBRI, which is a trust-based relational training. This is something that I've been working very closely with a social worker downstairs, who we've been just very passionate about it, because it's a very, very simple concept. And the more of this information we can get in hands of folks, and so we've done multiple trainings over the last few years, but just got done with 4 more trainings that we're offering to daycare providers, because guess what? Those little ones are coming into their homes with trauma or lots of stress and bring in lots of behaviors, and they need tools. So we're training foster parents, social workers, adoptive parents, grandparents. We're seeing more and more grandparents who are taking in their grandchildren. And how do you help them with some really simple tools that are really basic? And that's the feedback. And in fact, we did an evening training 2 nights in a row for daycare providers, and I talked to a daycare provider who said, I've been doing this for 30 years. This is the best training and most logical training I've ever attended. So I thought that was a pretty good sell when somebody who's gone to different trainings for 30 years said that wish you would have had it years ago. So we're doing a lot of that, and with a lot of support from the Wilmer Foundation on that one. The Women's Fund is really looking at trauma and helping kids in our community. So great partnerships. I just wanted to kind of lay out here too. We've done funds, we have our local collaborative time study dollars, which we draw down federal funds through the state that we collect through our partnerships with schools and probation and public health. But we've given $5,000 for county social services to do reflective supervision, and not that need a testimonial from Ms. Lippert, but reflective supervision is just a great way to support your staff in their everyday work that they do, and to come together, support one another, best practice, talk about best practice and changing needs. Candiac County Public Health received. And so that, again, I love the fact when we can do this, and this is one public health has been doing together. All 5 of the counties, they come together, or the supervisors come together. What a great way to support each other across boundaries and reflect with each other. So, and Candiac County receiving some of the TBRI video series. So they came to the trainings, loved it, and they're doing great work because they got tons of the training video series and are sharing them with Woodland Centers, sharing them with UCAP, sharing them with their families they're working with, and doing that. So a way to spread the wealth, so to speak. And just, yeah, New London Spicer Schools, social skills group equipment for their special ed department, and Candioi County Community Corrections. I loved the fact that they applied for this money, but to help a lot of their clients who are doing skills and skills groups and giving them positive interactions in their community. We know that so many people that are coming through the corrections door don't necessarily feel a part of their community and connect in the same way. So some of these incentives to help them reach their goals and positive interactions in the community. So those are just kind of some of the little highlights. One thing I didn't have in here, oh, yeah, go ahead, Mr.
I just have a quick question circling back to connecting families. Can you tell me what a sensory-friendly movie is?
Oh, yeah.
That would have been my question.
Yeah, so a lot of our families, and I'm going to use a quote we had, that, so if you have a family of 3 children, for instance, and one has maybe some struggles and some issues, and I don't, and they sometimes are behavioral issues that come out behaviorally, they will say, and this was from a parent, "Thank you so much. This is the first time our family has been able to do something like this together." But basically, we're partnering with these movie theaters who schedule a time, a matinee, like on a Saturday or a Sunday. We try to do them, over a break, holiday or something. And that movie is only for the families that sign up through us. So the lights aren't quite as dark. The sound isn't quite as loud. And kids are able to stand up and move around if they have to without bothering, the people that are right behind them. And so the whole family, they can spread out, they can do their own thing. Not, families aren't going to get upset if there's a little bit of whispering in the theater. So it's been a great deal. We've gotten monies from the area YMCAs to do this, but it's encouraging again because the movie theaters, it's really kind of a good deal. We pay for the tickets through the funds, but then they still purchase their own popcorn and candy and things. And so the theater in Hutchinson now is starting to do it on their own because it's kind of a win-win for them too. It's been a positive experience for them. They get something in return, but and the families are able to do it. One more event where the families kind of come together, see each other, talk to each other, but they get to do something as a family together, and that's really important.
It's more of an event rather than a movie.
Right. We find, family-friendly movies that can be shown, but yeah. Okay. Yep, the sensory-friendly is just not going to be overwhelming, because some kids who are struggling with things, just even that intense, I struggle sometimes with how loud those movies when they come on. And so-
Like Top Gun? Who would know?
Commissioner Anderson.
So my comment would be, the reason why you do this is because maybe the parents or the families don't feel comfortable going on a regular movie night as well, right? Because their kids might be more disruptive than other.
They might end up leaving, 20 minutes into the movie saying, oh, okay, this is not going to work. And then, and there's more to it than that. And so many times, especially if you have one child who has the struggles, that one child becomes that focus, and they don't, maybe then, we never get to go to a movie because Tommy, or whatever. But the family can actually do something enjoyable together and reduce stress, and they can actually do it because I had a child who had a temper tantrum once in the grocery store, and it's embarrassing. It's hard. You leave, with trying to get out the door as fast as you can. And so, yeah.
All right. Thank you.
So the next page, I just really highlighted some of our grants that we have, some of our large grants. And I want to highlight our Partners for Success grant, which is Renville, Candioi County, and Yellow Medicine County. So we all know we've had the drug-free coalitions for a lot of years, especially in Renville and Candioi. Yellow Medicine didn't have a coalition for a while and now do, but this is really that planning grant to help sustainability, help really plan. This is where we're hitting the data hard, finding out what are the pieces that are effective. And so I know you've heard some updates about the coalition over time, but this is a 5-year grant. And we just finished at the end of September, year 2. So there's 3 years left of this grant to really work on that planning. And I do know that in November, all 3 counties are getting together virtually to really just talk about sustainability efforts and things. So we've just, I think a lot of success with this. And we know the money's not there forever. So how do we plan? What do we find that needs to happen? What's the most effective? What's the most impactful? Family Permanency Grant through the Department of Human Services. This actually is a grant we just we're in year 3. It was a 2-year grant, but they gave us a 1-year automatic extension. There is an application. So this grant will run out in June 30th of 2023, but there's an application coming out probably December. And the state is thrilled with the work that we're doing. We've actually, this actually is a grant applied for because Ms. Lippert reached out and just said we need help. And with foster families, kinship placements, we're finding so many families are fostering kids, but they're giving them back. They're saying, this is not what I signed up for. I don't have the skills. And then we know we just have disrupted a child's life and created a traumatic event. And so we've got a couple people on staff that work throughout the counties. We do one-to-one support, again, activities that bring these families together because they're unique. Even those foster kids then that come together are unique. And to be able to come together with other kids with shared experiences is really supportive. And we've been told by the state we have the approval, the written approval, but it hasn't come through legal yet, but to partner and do a kind of a pilot within this with Candioi County and having one of our staff who actually has experience adopting her niece. And so reaching out for relative searches. So we're going to try it and see if it's helpful. And I keep looking at Jenny because I really am excited about it because the idea of maybe not having a county social worker and just calling up and saying, hey, I understand your situation. I'm in that situation. I'm working in partnership with the county, but trying to find those relative placements on the front end. Once again, on the front end. Helping not have so many placements for these kids. And so we would like to have like 20 hours a week of that position, being able to just doing those phone calls and those outreaches. So hopefully we have good news. We were hoping to get this before that new RFP came out, so we'd have a little bit of data and a little bit of information to talk about that, but we've run it by the state and they think it's a great idea as well. So that is very specific to Candioi County. So, and then the Journey to Independence, again, is just that federal grant talking about, basically, it's a rural model that we want to try to see if this is something that can be useful in rural settings and demonstrated across Minnesota. We've gotten a lot of support from NAMI Minnesota, Minnesota Social Service Association, about just working in this model to help those kids that 16 to 21, 22. We know they get maybe children's mental health, they're getting services in high school, but what happens maybe when they turn 18? They're out of school, they maybe don't have a plan, they've now out of children's mental health services, and not all of them fall off the radar, but many of them do. And that's really the group of kids that we're focused on, is we don't want them to be unemployed, getting into trouble, and then having their mental health issues grow instead of being managed. And so we've had about 40 kids through this program getting one-to-one support. And I would say the biggest thing is jobs, finding them jobs, and healthy social supports. I mean, I'm very directly connected to that data on, but finishing school or maybe even going on to some level of school. So more of that, this is real significant because this is something that as we are trying to immerse within our community, maybe having corrections trained, social services trained, some of our school social workers, staff trained in this model. So it becomes immersed down here, not as something that is a after effect of crisis response, I guess. So, and then the last thing I had on here, we don't have a lot of current data right now, the Minnesota social service data and some of just with COVID, Minnesota data should have been compiled at this point already, and it hasn't been. And we will be doing our data collection this spring again, but I don't think this is going to change that the uptick of kids who are dealing with mental health in the home. So if the families, so I just pulled this one out to just highlight that the needs are growing, they're not going away. And so if I kind of circle back to when I said I was done before, is that prevention is so important right now. And I know it's hard always to show that return on investment, but there are ways to look at that. But is that those young kids who are coming up, if we don't support the families and those young kids' needs, they come on the other end. And those of you that know me know I've spent a lot of time in my career working on the other end, and I've seen the cost, the time, and just the turmoil that it can cause families and communities. I mean, just really communities. So I just stress that importance of prevention. And I know it's easy, and I know we're used to responding because that is just human nature and that's what we do. But we need to just have a real wide lens right now on both ends of the spectrum with mental health. So, any more questions?
Commissioner Anderson.
I just have one comment. That journey to independence, I think that's a good idea. I don't know, a lot of people don't know this, but in a lot of countries, and maybe it's been here as well, kids without family or foster care, I suppose, but in other countries where they're orphans, when they turn 18, they're just like out the door and good luck, type of thing, and that's it. And so it's good to see that there's something to help them transition to their own independence, so.
Right. Setting goals and meeting those goals. I mean, that's what we're finding. Some of them have just never thought about it, and they've not had someone help them make those goals and attain them. They just kind of throw their hands up and, so, yeah.
Any other questions? And you're going to give an update on some of the changes?
On me? So those of you who know, I've actually given my notice at the collaborative. I was telling Commissioner Berg that there were 10 applicants, 4 interviews, 2 finalists in my position, and they are doing kind of a second informal this week. And however that is, I have said I'm definitely able to help transition that person. I'm here, I'm available, whatever that looks like on projects or just activities. So I'm not up and leaving in that transition, so just able to help because there's a lot of irons in the fire at any given time with 5 counties and 17 schools, and so, yeah. So that.
Administrator Kleindahl.
So I want to thank Rochelle. Kind of watch her growth in her career. Doesn't mean she's not as old as I am. But I watched her from one end of the spectrum working with kids that were in trouble and too late. And she decided that she needed to do something to try to prevent some of that stuff. And the stuff she presented today really does talk about that prevention. And I think throughout my whole career, every time we appear before the board, we always talk about prevention. And it's hard for boards and communities to put money to our prevention because it's hard to prove. But we also know, if you look at the trends, if you do nothing, these numbers here, I guarantee you, when you look at the next report after COVID, the numbers that you see percentage-wise in the homes is going to change dramatically. And what PAC4 has done, and by having this collaborative, it's kind of wiped out the county lines, the school district lines, and says, okay, let's put our resources together as a group, not just think about the county or a city or the school. Let's try to do something together. And so I appreciate all the journey you've kept us on, and Don, Canyon County and the other 4 counties should be very proud.
Thank you, and I actually highlight my first job out of well, I worked at Prairie Lakes Youth Programs, but my first, I don't know, big girl job, I guess, was working downstairs in public health. And in the early 90s, and those of you who remember that Candioi County had the highest teen pregnancy rate in the state of Minnesota in the early 90s, and that was my first job, prevention.
Prevention.
So I work prevention, and I think that's where my heart is. And if you look at the trends, I think you can see that. We did come down. I'm not saying it was all due to me, but we had everybody at the table trying to come at that from lots of different angles and try to solve that problem. And we didn't keep that title, forever. And so it does make a difference. And I highlight Yellow Medicine County too with the drug-free coalitions. They lost their coalition for a number of years. Their numbers were down just like Renville and Candy, Ohio, but those years that they didn't have their coalition and weren't doing efforts, they rose fairly quickly. And I think the commissioners over there recognized that and said, oh my goodness, we have to do. So it is hard. You can't say definitively all the time with prevention, it was that and that and that, but you can really try to narrow that down and put your efforts where they need to be and help, so.
I would also like to say you've done such an excellent job, and that's what the collaborative is all about, is promoting collaboration. And just for the public's information too, a little bit back on PAC4, it's really 5 counties, and it's a joint powers between 5 counties trying to work on children's services and children's mental health services, and having the flexibility that we often don't have as one county. And by coming together and working collaboratively with the other counties and other groups within the counties too. It wasn't just the counties, it's private providers and so forth, that we're able to get all these different kinds of grants. But your leadership has just been so important. It's been interesting to hear and follow over the years, PAC4 House has had the flexibility to adjust. And we've gone through so many changes, and it's so different now than it was probably 10 years ago or 5 years ago. But your leadership is going to be really missed, and we are very thankful you're going to still hang around to help us with this. So.
Well, and as I said last week at the collaborative meeting, I'm looking forward to being a volunteer community member. I've spent a lot of times just doing this, but because my passion is community, and so.
The good news, we still got you in the community.
I'm here.
Yes, and all your background. Also, I want to comment about your educational background is very, very well stated. Yes, well known. So thank you.
All right, thank you very much.
For the update.
Thank you.
And wishing you the best and stay in touch. All right, thank you. Now I'd like to call on Candioi County Environmental Service Director. And you got some updates for us?
Yes, I do. Thank you,
Welcome.
Mr. Chairman. Yes, Gary Gear, Candioi County Environmental Services Director. Just updating the board on where we're at with the sale of the recycling center building. And back in September, the board approved initiating that process. And on November 2nd, the city of Wilmer approved the preliminary plat application. And tomorrow evening, we'll be hearing the final plat application. So once that has been approved, we will be able to initiate the final steps and then get the plat recorded. And then that would lead us to the 3-week required public notice for bids. And then that would be, the bids is what we would be then ultimately bringing back to the board to review and possibly sell the building.
And you don't need a motion?
I don't need a motion.
We do need a motion.
We need permission to put it out for bids officially,
Oh, okay.
And-
I
and
thought we
so-
had that. So yes, we can
to
certainly do
advertise
that.
it, Mr. Chair, to
So-
advertise, and once we get the final plat approval, he'll put a date on it, and we'll announce that date at the next board meeting, and then we'll open the bids at this board meeting.
Okay.
Are you asking for that action now?
Yes,
Then I would so move that we authorize staff to advertise for bids upon a final plat approval.
Motion by Commissioner Gardner. Is there a second?
I'll second that.
Second by Commissioner Anderson. Any further discussion? And it looks like Commissioner Emdek.
Mr. Gear,
Yes.
you maybe already answered this question, but Are there parties interested, showing interest in this property?
In working with this, with Mr. Kleindl, there has been interest in the property, and
Maybe can't disclose who the parties
exactly,
are.
but would be hopeful that we will get, secure some bids that the board can consider.
Thank you.
Okay. And the plan that you have here, since the last board meeting, you shared this with us, hasn't changed at all?
That is correct.
Everything's
Yep,
correct.
it's the,
We have a motion, a second. Any further discussion? Hearing none, I'll call for the vote. All in favor, say aye. Aye. Opposed, same sign. Pass unanimously. Thank you very much for
Thank
bringing
you,
us
Mr.
forward. And
Mr.
we're
Gear.
looking forward to
making a sale.
hearing about the bids.
All right.
Okay,
Thank you so much.
At this point, we're going to take a recess for about 10 minutes, and we'll be coming back to an update from Woodland Centers, Mental Health Centers.
a few more counties. Hopefully everybody joins.
Swift.
Ashley, you probably wouldn't even be doing this kind of meeting if it wasn't for COVID, right?
Right. Well, I think part of it is just getting everybody together at the same time, and that's a challenge. So
Yeah,
yeah,
but being able to Zoom like this is,
We're waiting for Renville
Right.
County.
yeah, technology. I love it.
And me.
Yeah.
He's gonna eat, and I'm like, God.
He leaves a little envelope for her.
I'll do that to my mom. She's like, God.
Poor
can't
Frank.
handle it.
Good discussion there last
She just shakes her head.
Yeah, exactly.
They must have just.
Meeker County down here? It's not Renville.
There's Aini.
We're just waiting on Renville and the rest of the folks from Chippewa. I'll give them just a minute or so. Here we go.
I saw David.
Oh, we're not assuming.
No, that's fine. It works. That's fine.
It's a phone.
Okay. See what's in writing. Nothing. By golly, I got it right.
We're just waiting on Renville at this point. I haven't heard anything, so maybe give them a minute. Hopefully they come in.
No, Greg Snow's always last, so.
Yeah. Well, he can't be teaching anybody a golf lesson.
Wouldn't think so. I have to give him a time just because he's always, even for Redville County meeting, he's the last one.
Oh, yeah. We have,
That's them.
we have an indoor facility, which is pretty cool. So,
All right. I think we're all here,
Okay.
so we can probably call our meeting to order. Thank you, everybody. This is a big deal to get all of you in a room kind of like this. So I appreciate y'all being here. So we'll start the meeting. So everybody is prepared to do so. Hopefully we can go pretty quickly and not have to have too long of a meeting. So welcome. First ever, probably all of us
It
being
is.
able to be together. First, I'd just like to do some roll call. We'll go by county just so that we make sure we know who's in the room and who maybe isn't here today. So I'll start with Big Stone. Jay Backer.
Here.
Oh, this is not here.
Here.
Wade Avey.
Here.
Brent Olson.
He's absent.
Roger Sandberg.
Here.
Jeff Claggett.
Here.
All right. Chippewa. Matt Gilbertson.
No.
Yeah, okay. Candace. Here. Dave Nordon.
Here.
Phil Pauling.
Here.
And Dave Leeser.
Dave is absent. Here.
Oh,
he's there. We also have Lisa, our family service director, in there as well.
Perfect. All right. Candy Ojai. Corky Berg.
here,
Steve Gardner.
Here.
Raleigh Nissen.
I am here.
Roger Indike.
Here.
Dwayne Anderson.
Here.
All right. Lacaparo. Todd Patzer.
Here.
Duran.
Here. Bramer.
Bramer, sorry. John Mack.
Here.
Ben Boffin.
Here.
Stacy Tufto.
Here.
All right. Meeker County, Danny Shufflebane.
Here.
Paul Johnson.
Here.
Beth Oberg.
Here.
Steve Schmidt.
Here.
Julie Bredesen.
Here.
All right. Renville, Randy Kramer.
Present.
Robert Fox.
Present.
Doug Erickson.
Present.
Greg Snow.
Here.
Dave Hamry.
Here.
All right. And Swift, Gary Hendrick. Edward Peterson.
Here.
Pete Peterson.
Here.
Joe Fox.
Here.
And Eric Ruddigan.
He's absent.
Okay. All right. Well, thank you, everybody. So first and really only line of business is the update to the Articles of Incorporation for Woodland Centers. I can just give a brief history, answer any questions you all have, and then we can kind of move forward. But Woodland Centers has not really updated our Articles of Incorporation for quite some time, and we noticed there was a significant need to in order to get them up to really what the law says and what the standards are in the industry. And one of the major points is this membership. For Woodland Centers, we've always had a membership line item in our Articles of Incorporation. But as you can tell, pulling the membership together to make any changes can be very tedious and really has not been our practice. And so we are looking at making that, that's really the big significant change that we're looking at for our Articles of Incorporation. The changes that we're making do not change the structure of our board of directors. That would still remain the same. This is really just changing how we are looking at, again, just our articles and how we are comprised as an organization. I did send out the most recent version of the articles, and I can pull them up here. If there are any questions, I'm happy to answer those. The one change that I would look for in the articles that were not in the original document I sent out, this was actually brought forward by a commissioner from Renville County. The only change I'm looking at would be this last piece, that the articles can be amended by 2/3 majority vote instead of just a majority vote. And this would keep it in line with, otherwise, I would answer any questions or if there's any discussion folks would like to have.
Any questions?
I'd like to hear your opinions as to what is being proposed here. Paul and I have a couple of questions, but.
Yeah, I just think they're very outdated, and there was you cannot have every board member of every county voting on things, so that was the main thing. I think it was just an update. I don't have questions. Danny, do you?
No comments. I was just wondering something about the board of directors, and it's under item number 2C. It said added language about resignation and removal. Bylaws and silent on this clarifies the process for recommending and electing new directors. So if we recommend 2 directors, are they then elected?
Well, I think it's, Ashley, you can answer this if I'm wrong, but I think we've always brought them before the annual board meeting, haven't we, Ashley? Do you want to answer that?
Organization.
Yeah, historically, that's where, that's what happened at the membership meeting, is that counties would recommend 2 individuals and it would come before the membership meeting and the members would then vote that in. Because we would be moving away from members, it would come before the board and the board would make those decisions. So each county would recommend 2 individuals and then the board would then take that action. So it wouldn't be a big shift. It would just change it from the membership back to the board and giving the board complete control over that.
So basically, we could recommend Danny and Beth, and if there was a conflict or something between other board members and Beth, they could choose not to elect her.
Essentially, if that was what the board decided, it'd have to be a majority vote, which is pretty standard language for any nonprofit board that members are elected on.
Anybody else got questions here?
Ashley? I think overall my question is almost like a point of order here. I believe if we're going to make a action item that the president or Beth should probably be conducting, opening up the meeting and doing the business overall. That would be my thoughts.
Oh, I didn't even think of it that way. Thanks, Gary.
Leave it to Gary. So I'm opening, the meeting is open. I'm opening the meeting, virtual meeting of regarding changes to the Articles of Incorporation for Woodland Center. So we would entertain any other questions if anyone has any. Anybody have questions here?
Roger Emdick, Kennewick County.
It answered it. Like it.
Yeah.
I didn't hear that. Who was that?
This is Roger Emdick from Kennewick County. When would this go into effect if would it be after your annual directors meeting or would it be after today?
Effective immediately after the vote. Yep.
Currently, how long are the terms for board members?
Yes or no?
Is it annual? Is this voted on annually, or what would be the term?
Yeah, right now our bylaws are silent to that, and that would be in the bylaws. And so what we had recommended, I believe, was annual. Now I don't remember because those were bylaws. I believe it was 2 years.
It's 2 years according to what I'm looking at.
Yeah, yeah.
This is Raleigh and Candioi County. It added language about terms
Yeah.
for directors. Terms of 2 years, unlimited
Correct.
number of terms.
That's correct. Yep.
All right, this is Beth. Does anybody else have any questions? We'll move along here.
Well, I was just going to ask, this is Jay Backer from Big Stone. Are we then, there's no other questions, we need an individual to make a motion right now? Is that correct? If that is, I will make a motion to pass these updated articles.
I have a motion by Jay Backer to pass the Articles of Incorporation. Do I hear a second?
Greg Snow, Renville County will second.
Commissioner Snow seconds. Any other discussion?
I would like to ask another question.
Sure.
County attorneys have had the opportunity to look these over, and you believe these to be in line with what should be done?
This isn't a joint powers board. This is a nonprofit.
I understand.
Board. So I don't know.
Oh, yeah.
I don't know if that was even.
All right, if it's an eligible question, so be it.
I mean, I understand it when it's a joint powers board, but I'm not sure when it's a nonprofit board that. Ashley, do you have any input on that? Did you hear the question?
Yeah, I would say that it really wouldn't be part of the county attorney's purview to review these because it's really not your role as a county commissioner. You're here as a member of the centers voting at this time.
That's what I thought.
My only concern, this is County Attorney Schiefelbein, my only concern is that I would be here to review this because you guys are now voting on something.
Right.
And if something were to come back to the counties, that I'm here to be your legal representative. So I'm.
But looking it over ahead of time wasn't.
What's in the best interest of Meeker County versus what is in the best interest globally? I think the point that Commissioner Johnson brought up is something that could be worth a discussion.
So I disagree, but I'm not going to disagree with you. You're an attorney. This is why is everybody laughing? This is all we're doing is changing something that should have been changed probably 15 years ago or how many. I don't know how much. When we have a joint powers board, Commissioner Johnson, it's different from what we're serving on a nonprofit board. Things are changing, and I don't know. I mean, we sit on the board as advisors. That makes sense. So, anyway, that's, any other questions? Does anybody else have questions? If not, we're going to proceed with the vote. Ashley, how, is that by each excuse me, each member, or?
Great question. How would you like to do that?
I think roll call by county. So if you want to.
Should be each member. Madam Chair, it should be each member, just as you did the introductions.
Thank you, Commissioner Kramer. All right, so we're going to start. What county do you want to start? And then they can do their roll call, I guess.
Just go in the same order if that works.
Go ahead.
All right, Jay Backer,
Yes.
Wade Acey,
Yes.
Roger Sandberg,
Yes.
Jeff Plagas,
Yes.
Chippewa County, Matt Gilbertson,
Yes.
Candace Janish, yes. Dave Nordon,
Yes.
Bill Pauling,
Yes.
Dave Leeser,
No, he's right there.
Dave Leeser.
Yes, Dave Weezer, yes.
Come on, Dave, pay attention.
In the Ojai County, George, Corky Burke,
Yes.
Steve Gardner,
Yes.
Raleigh Nissen,
Yes.
Roger Indike,
Aye.
Dwayne Anderson,
Yes.
Lacaparo County, Todd Patzer,
Yes.
Deron Bremer. I might say that wrong again. I'm sorry.
Yes.
John Matt,
Yes.
Ben Boffin,
Yes.
Stacy Tufto,
Yes.
Meeker County, Danny Scheffelbein,
Yes.
Paul Johnson,
Yes.
Beth Oberg,
Yes.
Steve Schmidt,
Yes.
Julie Bredesen,
Yes.
Renville County, Randy Kramer,
Aye.
Robert Fox,
Aye.
Doug Erickson,
Aye.
Greg Snow,
Aye.
Dave Hamry.
Aye.
All right, Swift County, Jerry Hendricks,
Yes.
Edward Peterson,
Yes.
Pete Peterson,
Yes.
and Joe Fox.
Yes.
Didn't miss anybody, right? We got everybody? Back to you, Beth.
I don't think there's anything else to come before us, so do I have to have a motion?
Say just a minute, Beth, may I just say one thing?
Yes.
I don't know
Is
if
it you,
it's.
if that's you, Raleigh.
This is Raleigh.
Yes, sir.
I don't know if you folks in all of the other counties saw this, but Woodland Centers was awarded a statewide attaboy from NAMI. Maybe, I don't know if I'm saying it correctly, but Ashley can maybe chime in here. But congratulations to Woodland Centers for that. That's all.
Yeah, we were awarded a Provider of the Year from NAMI, Minnesota. It was a really big honor to be able to obtain that award. Yeah. And I would be remiss to say, because it was spoke, I am out in Big Stone County coming to you live today. So I just wanted to put that out there.
Thank you, Ashley. Yay! In order to build Big Stone, all right.
Leave it to Jay.
Thank you, Beth. Thank you.
You're welcome. All right, if nothing else, I wonder if we have to have a motion to close this, huh?
Probably.
I think so.
Raleigh
Okay, I'll
Nissen
take a
will so
motion to
move.
close. Moved by Raleigh, do I hear a second? Anybody?
Second.
Second by Commissioner Sheffield. All right, we're adjourned. Thank you, Ashley.
Thank you, everybody. Appreciate it. Thanks.
Thanks. Okay.
Okay.
So if we could just take a 2-minute recess and get everything cleaned up here?
I hereby take a 2-minute recess. I hereby call the Candido County Board of Commissioners back in session. At this point, I'd like to call on Mr. Smith. You have an update for us, or more than an update, you have a resolution.
What's your name?
I do. Good morning, Mr. Chair, members of the board. My name's Corey Smith, the director out at Glacier Lake Sanitary Sewer and Water District. Today I'm before you with Resolution 2022-59, and that is for the county's consideration of assessments pertaining to delinquent accounts for sewer and water. This year there are 3 separate delinquent accounts. If you look at the resolution, the first one is parcel number 27-300-0160 for $1,932.64. The second parcel is 27-774-0030 for $1,882.08. The third parcel is 27-022-290 for $352.78. Letters have been sent out throughout the year for these accounts, identifying their outstanding balances, and that is in addition to the mailings of the monthly utility bills. October 24th, the Glacier Lakes Commission met, and they reviewed the status of the delinquent accounts and recommended forwarding it to the county board today. So with that, it is staff's recommendation to adopt resolution 2022-59 to recover the outstanding balances.
Commissioner
So moved,
Nissen,
Mr. Chair.
Motion?
I will second that, just so I, but I
Commissioner
do
Emdek,
have a,
second by Commissioner Nissen.
I have a question.
And Commissioner
Parcel,
Nissen, please proceed.
The second parcel, 774-0030,
Yes.
that has been a problem before, correct?
Correct. A couple of these on here have been repeats. Yes.
That's,
Yep.
and how do we, do they pay up every year? or-
Yes, they do. Yep. And I'm not sure, because if you look at it, the late fees kind of outbalance the usage fees, so.
You would think that they might learn from previous experience, but
Commissioner Anderson.
Yeah, so my question is then, the late fee is quite extensive so how late are they on these bills? I mean, this must go back many months?
Yes, basically the first 2 did not pay at all.
Okay. And then on this late fee, since that didn't do anything, when we put it on the county, is there going to be interest added, or is it just the late fee and that's all we're going to do? Or, I mean, I know it's extensive with the late fee, but it didn't seem to make
Right, it would be for that total amount.
Okay.
yes.
Okay. Commissioner Emdek?
Thank you, Mr. Chair. And Corey, if do they generally send a check, or do we put this on as an assessment on the property tax?
It goes on to the property tax assessment, correct?
And that might be why someone just chose to do it that way. It's simple, but it is expensive.
Right, yep.
And the last one is not really, if I may continue.
Please continue. I think you have the same question I had. I bet.
So this has to do with someone in the campgrounds, I think it is, where
Correct.
but you can't assess the campground, you have to assess an individual also. All right, maybe you can
Other-
explain
yeah.
it better.
Yeah, we
Or
cannot.
the other way around, yeah.
Right, we cannot assess an individual person inside of that parcel. It has to be to the landowner.
And and Koyman is the owner of that campground.
Correct.
Gotcha. Okay. Any further questions? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously.
Thank you.
Thank you very much for bringing that forward to us. At this point, I'd like to call on Candido County Health and Human Services Director, Ms. Lippert. Good morning again.
Morning, Jenny.
Good morning.
Good morning, Mr. Chair and members of the board. I am going to plug in a PowerPoint as this morning I'm here to talk to you about the 2023 managed care health contracts for Candido County.
I'll give you a few seconds to get that set.
kept undershooting.
Come on up. There you go.
There we go.
All right. So every 5 years, the Minnesota Department of Human Services, by statute, is required to hold a managed care procurement for the Minnesota healthcare programs. As you can see here are the long-awaited results for the 2023 health plans for Candiota County. Blue Plus and Prime West have been awarded for our prepaid medical assistance program. Blue Plus and Prime West have also been chosen for the Minnesota Care program. Prime West has been added, so we'll have Blue Plus, Prime West, and UCare for the MSHO, or the Minnesota Senior Healthcare Options. And then Blue Plus, Prime West, and UCare have been awarded for the Minnesota Senior Care Plus, or MSC Plus program, and then Medica, Prime West, and UCare again for the SNBC. Every year, enrollees get to choose which health plan they want to enroll with for the program that they are eligible for. Our staff cannot assist or direct folks to choose one plan or another, and neither can health plans. Most reoccurring enrollees will stay with their chosen health plan year after year. However, there are a large chunk of individuals who do not choose a health plan when they have that option. In these situations, the state picks one for them. As you see here, for the PMAP program and the Minnesota Care program, Prime West has been awarded as the sole default plan. This means that if an individual does not choose one of the two options of Blue Plus or Prime West, they will automatically be given the Prime West health plan. For the other three, the MSHO, MSC Plus, and SNBC programs, the default rotates between the three plans. So again, if someone doesn't choose the health plan, they would then default between the three different health plans. The next couple of slides, I have comparisons so you can see throughout the state of Minnesota what health plans have been awarded by county. So on the left-hand side, you will see currently what health plans serve Candiota County and throughout the state of Minnesota. And on the right side, you will see that this is for the 2023 year. So for 2023 in the PMAP program, you will see that UCare is exiting and Prime West has been added for Candiota County. Same with the Minnesota Care. We have historically had UCare and Blue Plus, and now UCare has exited out, and it would be Prime West as that second option. For the SMBC program, we are adding a third health plan. So on top of having Blue Plus and UCare, we will also entertain Prime West as a third option.
Mr. Chair?
Commissioner Emdek.
We're kind of an outlier on that one in terms of the three plan choices for SNBC. Do you have an explanation? No.
I don't. Again, when we were looking at this, we looked at it as a region. We scored health plans as a region. And you'll see in the next slide that there's another county that has an outlier with actually 4 plans. So I really do not have any detail or rationale as to why we were chosen 3 and other counties just still have the 2.
All right, thank you.
Mr. Chair?
Yes.
So
Mr. Klein.
just understand that every time we have an extra plan, so the more plans you have, that's more administrative work for our employees to learn those programs, the documentation they have to provide. And so it does put a burden on the local units of government when you have extra plans.
Then could I ask a question?
Mr. Anderson.
So these different plans or choices or whatever, is that decided by the state, or do you work with the state, or?
So it's a combination. This year's procurement process was a little bit more county and state driven, we would like to think. So we as a county could have as many representatives as we wanted. I chose to do it myself and represent Candido County. It's a very lengthy process. It's days and days of reading materials on every health plan and then sitting down and scoring. And then this year, what happened was, since we decided to do it as a collective region, Region 6 and 8 human service directors together, then we actually met with DHS and had a conversation with them about how we interpreted and how we scored health plans compared to DHS had some staff as well doing scoring of the health plans. And we had a conversation with them. And then it went to the state to look at all of the counties, all of the scores in conjunction with DHS's scores, and then they pre-populated which awards should go to each county. So in theory, I would say yes. We did have some discussion, and it was in partnership with DHS. However, as we've talked before, and I've presented to the board in the past of our hope with single source and not having multiple plans, we still feel as though it wasn't the best outcome that it could have been for this procurement process.
Okay, thank you.
So this next slide, then you'll see the MSC Plus, and here to Commissioner Imdek, here you see Lacoparo County has been awarded 4 health plans for this product. So again, some outliers, but for the most part, we are in conjunction with our 6 and 8 other county partners. So again, for Candido County, we have an added 3rd plan, which would be Prime West entering in for this product. And then the M show, again, adding a 3rd plan of Prime West as that 3rd option for folks in our county. So this slide, you're going to see current enrollment numbers as of October for the health plans that we currently have in Candido County, which is Blue Plus, UCare, and then we have a small fraction of Medica members for the SNBC product. So Blue Plus, it makes up the majority with 8,034 members. UCare totaling 4,559 members, and then Medica with just their SMBC product, 119. So as we look to 2023, I want to focus your attention to the top 2 under UCare for the PMAP and the Minnesota Care, the 3,328 members and the 322 members. Those folks will have to choose a different health plan come 2023, or it would default over to Prime West. That would be the thought with those UCare members. Any question on the numbers as they stand today with enrollees and where they lie within our county?
Mr. Chair.
Commissioner Imdek.
Thank you. So just generally, the prospective clients are not people who have private insurance, correct? Can you expound a little bit on who those clients would be?
So these are folks that qualify based on income and eligibility to have county health insurance. And then the county then contracts with these managed care organizations to provide the insurance for these folks out in our community.
So, and some of them are elderly and some of them are not necessarily, some of them are children, whatever. They're different segments of our demographic.
Correct. So if you see the top 2, the PMAP and Minnesota Care, those are primarily normal adults, their families in our community. The Minnesota Senior Care, that would be seniors in our community. And then the M-SHOW MSC Plus, that program is again seniors. And then the SMBC is really geared towards those folks that maybe have some disabilities within our county.
Commissioner Imdek, please proceed.
Thank you. I'm having a little trouble with the projected enrollment, understanding the chart there. So you've got a January, July, December projection of the different plans. And are these new plans or are these, go ahead. You-
So I'm not there yet. I'm going to
Okay,
switch, we're going to switch gears now. So again, what you have in front of you is the current 2022, as of October 2022, number of enrollees in our current county. So as I switch to this next slide, which I think Commissioner Imdek you're referring to, this is projections that came directly from Prime West. Prime West, as they would be looking to enter into Kandiyohi County, they know that it will be some type of an increase that they would get to start off, since UCare would be exiting out for the PMAP and Minnesota Care products, and Prime West would be that secondary choice for folks in our community. On top of then being an additional third choice plan for the other three programs, the MSC Plus, the MSHO, and the SNBC. So what Prime West did was they looked at a fraction of the UCare folks, because knowing that those enrollees on UCare now will have to either choose a different health plan, which would be Blue Plus or Prime West, or if they don't choose, then the state automatically will default them into a program. And for the PMAP and Minnesota Care, which is the largest chunk of folks, that would be the sole default to Prime West. So right now, Prime West is anticipating, as of the first part of January, because folks have to choose by January, or again, the state will come in and choose the health plan for them based on the default model. They're anticipating they would see 1,764 enrollees into the PMAP product, about 120 enrollees for the Minnesota Care. And then you'll see these next couple plans, it's very minimal. And again, they are looking at their projections as an added third plan. Most of the time, folks, if they've already been on a health program with the county, they'll stay, kind of like you and I in the general public. Unless you're really upset with your health insurance, you're not going to switch. So with Prime West being an added third option, they're anticipating these numbers to be relatively low. They would continue to see a pretty substantial increase, being that secondary option and the sole default plan. And then their end of the year projections for 23, you can see 2,525 folks for the PMAP, 196 for the Minnesota Care, and then again, it dwindles down. Does that help?
Commissioner Imdek.
Thank you. It does, quite a bit. But you say the open enrollment is coming up. Then why will it change in July and again next December? Do they have that more than once a year? The open enrollment?
No, so they are anticipating new enrollees. So again, the open enrollment is just for folks that are currently on county health insurance, that every year, like everybody, you have to choose your health plan or renew your health plan or choose a different health plan. But every single day, we're getting new folks that are coming in that qualify for our county health insurance, and that's what their projections are. And again, by having that primary default for the PMAP and Minnesota Care product, and generally speaking, it is said that between 70 and 80% of folks do not choose a health plan upon enrollment. So they're anticipating those folks then would automatically default to Prime West and not go to Blue Plus.
Thank you.
Anything else? No. Just a quick big picture. These are the numbers that eventually we're going to get to as if we buy into Prime West, correct? Or our dues or whatever.
Correct. Yep. So just as a reminder, back on January 7th of 2020, you all, as the Kandiyohi County Board of Commissioners, signed to join onto Prime West as a joint powers board member. Back then, it was anticipated that the next procurement would maybe have a different end game, and we would be able to go county-based purchasing as a single source health plan option for our county. However, now with this information, you see that did not occur. However, I want to just remind you of the benefits of Prime West and with them being a joint powers health plan, what that looks like for Kandiyohi County. So they really develop and design programs to help members enjoy healthier and fuller lives. And they do this with a lens of rural healthcare, again, being made up of 24 counties and being owned by the 24 counties. There's a lot of input that goes into it from the counties and from social services directors, from county commissioners who sit on their board, and that's been very beneficial. They strive to achieve 4 goals for their members, and they call this their 4 dimensions of optimal health care. Improving members' healthcare experiences, improving member population health, achieving health equity across the entire population, and then improving the value of healthcare provided to their members. Prime West is integrated with public health and the social service agencies and other key players in communities that they serve in. And this integration allows for coordinated care across the spectrum and also cost-effective care for members. I would say one thing that Prime West does really well is how they are able to reinvest into communities. So if they end the year and they have a cash surplus, they automatically then look to reinvest those dollars back into the communities that they are providers in. And I think that that's very beneficial. And there's been some really great projects that have happened across the counties that they serve.
Ms. Lippert, I might add, when you say about reinvesting into the counties, for example, examples of that would be is that Health and Human Services could, or the Candidacy County Board say, we may need these kind of services here. We need a grant for such and such. We can go back to the group and those dollars. And so we'd have more control and more chance to get those dollars coming back that would have been profit, correct?
Yes, that is correct. Yep. Again, if there's a need within the county, you have a better opportunity to bring that forward when you have commissioners that represent their overall board. Yep.
I believe that Woodland Centers did already get a very nice grant for diversity, inclusion, and whatever the other one is, diversity, inclusion, and
Yes, I think that was,
Because they're involved with Prime West already through some other counties and it
Yes.
benefited us indirectly.
Yep.
Good point, thank you.
Yep. So giving you some more history, Candidacy County was a part of Southern Prairie Community Care starting back in 2012 up until 2018. Counties gave a financial contribution to Southern Prairie, and the intent was that when Southern Prairie dissolved, the counties would invest those upfront financial costs that they had given to Southern Prairie Community Care back into Prime West, if and when that would take place. So overall, there have been roughly $3 million set aside from the Southern Prairie dollars for the 13 entrant counties that were looking to join on to Prime West. And what you see here are additional dollars that Southern Prairie still has above the $3 million that was set aside for a join on to Prime West. So as you can see, Candidacy County has some additional funds that then could be used to join on to Prime West. And I don't know, Mr. Chair, you sit on the Southern Prairie board. I don't know if there's anything else you would like to add about when that dissolved or any history on kind of the thought of those funds being used to enter into Prime West.
Yes, and I think you summarized that quite well. Actually, I think you're going to get to the additional funds that will be forward, so I probably won't even go there. But,
Sure.
But there will also possibly be some additional funds that would come back to the county separate, and you're going to get into that, I think. Okay.
Yes, and I should just note, these are projections. These are not final numbers, but these are just projections to give you a rough idea of what that could look like.
But the question is, yes, we're going to work hard to close that out finally, maybe by the end of June 1st or end of May, let's put it that way.
Yeah, it's been a long couple years.
It's been a long time. It's one of those things. The government programs are hard to close out, but there's also a good reason we kept it going too, indirectly, and this is a good deal that we did.
Yep.
And I'd like just to add, the money is still there, and it is earning interest through the matching funds yet.
Yep.
And so for that amount of money, it does help.
So every managed care organization needs to have financial reserve, which they call risk-based capital. So risk-based capital is a slush fund for if and when there are members that have high costs and the health insurance and the overall MCO's financial status doesn't cover that. They need to have a reserve based on the number of enrollees that they have in their health plans. This is just some information that came directly from Prime West about how they have operated their risk-based capital. So they have never had to use any county dollars to support their daily operations. Only county dollars paid to Prime West are used for the one-time RBC contributions for new counties joining, which again, that would be to help maintain what they need to keep those funds at an accurate and appropriate level. Number of members enrolled in Prime West, as that increases, their RBC level decreases, again, based on the risk of potential new enrollees and health issues that might arise. As that happens, their risk level decreases and they need to have some financial cushion in order to keep that at a standardized rate. So this chart in front of you shows originally what Prime West had discussed with Candiac County, what the financial contribution would be if they would have been a single source, the only plan to serve Candiac County. They would have needed roughly $3.6 million from Candiac County to have all the members move over to Prime West. As I just shared with you earlier, that is not the case. Prime West is going to be an added health plan in a lot of our areas, and so they are only going to be seeing a fraction of new enrollees based on their projections. So in turn, that decreases the RBC contribution that they're needing from Candiac County to keep their levels at a standardized rate. On top of that, as I shared with you, Southern Prairie Community Care has funds that Candiac County had given them early on, and when that dissolved back in 2018, those funds were earmarked for an expansion and to join Prime West. And so really what I want to draw your attention to is the orange section here, and that is the recalculated RBC contribution, additional dollars that the county would have to come up with, taking the Southern Prairie money and knowing that those dollars would automatically go to Prime West. The additional Candiac County request from Prime West to be a joining member would be $258,523. So again, that would mean that the Southern Prairie money, that $3 million, would automatically go over to Prime West. And then on top of that, Candiac County would be required to give Prime West an additional $258,523, which is a major reduction to what they were anticipating years ago when we were having this discussion back in 2018. And if I can just make one little point about why that major reduction happened, is because originally they were looking at having all of our members move over to Prime West. If that would have happened in all of the counties, all 11 expansion counties, they would be looking at roughly 30,000 new members. So they would have needed that large chunk of money in order to keep their risk-based capital afloat. And now when we're looking at minimal, thousands in the thousands, not higher, that's why you're seeing such a decrease in the request for funds to join into Prime West.
Mr. Endek, you had a question?
So we're really comparing the $3.688 or $89 million to the $258,000. Correct.
Right.
Incredible reduction, but we give up a lot of opportunity because of now we have to share that market with Blue Plus and UK, or some of those other providers.
Yep.
I asked this question the day of our Prime West meeting. That almost seems like good news, but what am I missing here? What might the public be missing in terms of, why would we consider moving forward with a lawsuit against Department of Health?
So I think the good thing, and what I have heard from the CEO of Prime West, Jim Prisbilla himself, is having the smaller amount of enrollees with them not being a single plan is actually probably going to be more beneficial because they can plan and provide better service to folks in our communities. I should state that the projections that I shared earlier with Prime West, that doesn't include any marketing that Prime West would do in our community. That doesn't include any, and they're probably truly on the lower side. They really looked at this as kind of looking at lower projections. So we could see our numbers increase. But I think back to your question, by giving them time to get acclimated with our community, understand the people that go on all of these programs, we really will be able to tailor the service that they provide for our county's needs better this way than if all of our individuals moved over to Prime West and they would have had to take all of that in right away.
Commissioner Isaac.
Thank you. So our staff cannot make a recommendation for Prime West, but Prime West can come into Kaneohe County and advertise and market their services. So we may gain some people there. So let's say they're more successful than they think than what they're projected. Would that 258,523, would that then go up?
Not what we have heard. So they are saying that this is your one-time allotted amount that the counties that they need from the counties. It would not increase or decrease because they historically have never had to use county dollars for their general business operations.
Administrator Kleindl.
So just for the public's information, so the dollars that we're using for buy-in to Prime West, that's to cover our healthcare cost risk. Prime West has to have a certain percentage of dollars in reserve to cover healthcare risk. If you have a preemie baby or something like that, you understand the healthcare costs and that risk. And so that risk then is we pool the money together with the 24 counties, and those dollars are to cover the healthcare risk that's not covered. And so once we do our initial buy-in, and because it's going to take time to get as many people as we first thought to get enrolled into Prime West, the risk level starts out at a base rate, and it will slowly go up. But by having that time, you also are starting to gain revenue, and therefore our revenue that we have to put in upfront is less. And so this is a big change. I mean, a very big change for the counties, the 11 counties that are looking at joining. As you've seen, we're projected to look at 3.6 million to join to cover our risk if we had to do everything at once. And by having it slowly, as Jenny explained, the risk level that's covered is less. And so we can slowly build that up, and it gives the counties that opportunity time. The challenge with the counties that we'll have, again, I'll state this, is that the social workers, by having 2 or 3 different plans, have to learn 2 or 3 different plans, and it's a lot more work. It's like you fill in an IRS form one way, you have a state one, and you have a federal one, and say you had an independent one. Each one is different. You have to learn all those rules and regulations, and not every plan has the same rules and regulations. So there's still cost to us that you don't see here, but the cash layout is quite a bit less. I don't know if I answered that.
Yes, and unless there's any other questions, I do have one more slide, and I'm going to touch a little bit deeper as to what Administrator Kleindl was talking to you all about.
Very good.
So really, next steps and a decision that you all as a board need to look at is opting into Prime West and having that financial contribution given, that $258,000. But I also want to highlight that there is the potential and likely potential that it will cost Health and Human Services some additional dollars. I don't know what that looks like because, again, we don't have a crystal ball to know the number of enrollees moving over to health plans. Prime West has been already having discussions with us and our staff downstairs, and they have assured us that they want to do a wraparound approach with the counties, finding out what our leverage is to kind of working with the systems that they have in place. What do we have capacity for? What do we not have capacity for that maybe Prime West needs to take on? One big one is care coordination. Again, I was in front of you all about 18 months ago having the discussion about care coordination for the Blue Plus program. And at that time, we decided that internally it wasn't feasible for the county to do the care coordination. So an external provider took that on. That's another discussion that we would have with Prime West. Do we take that on internally? We're looking at projections of probably small numbers. Could we have a staff person in our office take that on for a while? But again, learning all of that, and it's only a couple clients or enrollees every couple months. We haven't really worked that out. Transportation, historically, the current Prime West counties have had to take on the management of transportation, and that's run through their eligibility department or financial department. With our current health plans, UCare and Blue Plus right now, we have not had to do any internal transportation coordination. That has all been done externally with CCT. And so again, those conversations have been had. We've shared those concerns with Prime West, but I do not know what that looks like. So I want to draw your attention to it. If and when I have to come back in front of you with an ask or proposal for additional staff or what it might be at that time, again, I'm unsure, but I know that we will have future and further conversations with Prime West, and we will really try to make this as seamless as we can, both for our staff and obviously for them. They have to have it feasible as well. My recommendation, again, we deal directly with these folks that are coming down to Human Services or the folks that are utilizing programs with public health. My recommendation is we should, as a Candido County Board, opt in to join Prime West, give that financial contribution, and I think having them in our community is going to be a benefit in many, many ways.
Ms. Lippert? Quick question. Looking at the case management aspect of it, not being decided, you still think, you feel comfortable that we can still work through that one way or the other, even if we make that decision now?
Yes. Yep. So we've already had internal discussions. I think we have some ways to move some staff duties around that if we did choose to do that internally, we would be able to do that for a little while.
And we are going to have additional financial needs, and it's really good transparency. Mr. Kleindl, thank you for bringing that up as well. But we are going to have a $2,726,000 cushion plus because we got another, I believe, a couple $100,000 plus coming directly from the Southern Prairie Community Care. Commissioner Emdek, and then you, and then Commissioner Gardner, please proceed.
So the $258,523 is a one-time payment for the risk management. We don't know what the potential ongoing costs will be for providing the services down in your department. Are we making a decision today whether or not to join Prime West, or will we have that number before we do that?
We can, or we could wait. We got until the end of December.
Okay.
Or the second board meeting in December, but we could.
But before I move on to that, of the $258,523, are there some other funds available to offset part of that, like the 97 or some thousand that we had in addition, or is that already included in there?
Mr. Kleindl.
The Southern Prairie money is in addition to that. That money that it's ours, but it's being turned over to Prime West.
That 97,000 or whatever.
No, 704,000.
700 total. So total, you take the total dollars that we're contributing from Southern Prairie and Community Care, and the 258,000 comes to 962 some thousand.
So if I may, if we don't do it, then that 704,000 would come back to Candido County.
Yeah.
That would go into our
I'm looking at Southern Prairie Community Care contributions, that $97,512 on a previous graph.
Go ahead.
So yes, those projections are what Southern Prairie is anticipating is above, so what the county would get back after the $3 million and everything is settled up with Prime West. These would be additional funds that Southern Prairie has that would go back to Candy Ojai County.
So that has not,
That's
let me continue, that has not been figured in the
No.
258,523. So
No.
essentially, let's call it $100,000, we reduce
Right.
our input cost from
Right.
258 to
Yes,
160.
yes, that is correct. Yep.
Okay.
I would like to thank you for a very well-presented presentation. If I can use presented and presentation in the same sentence. And I have sat on the board with Prime West since we volunteered, and I think we made the decision to go with them in the first place because we thought it was an excellent organization, and the counties that were already members have spoken very highly. I feel like I would want to make a motion that we opt in to Prime West right now.
And I would second that motion, Mr. Chair.
Motion by Commissioner Ness and a second by Commissioner Emdek to opt into this. Okay, further discussion. Commissioner Gardner.
Thank you, Mr. Chair. Larry, did you want to say something first, though?
Oh, it's
There's a promissory note, so just so you know.
yeah, I
that-
know, we got, we're jumping ahead here.
So that motion would be to join, but also to authorize to sign a promissory note,
Yes.
promising that
That's what
those
I
dollars.
would,
And yes, and we'll get into that now too, because our county attorney also had
Shane
an
has looked
opportunity to
at
look
it.
at that to see what it involved in. And
So that would
we feel
be
comfortable.
my motion, and
Yeah.
I'm sure that.
Yes,
the
we got a
second
motion and a
would-
second. Any further, yes. Mr. Gardner.
Thank you, Mr. Chair. I will be extremely supportive of this motion. I think it's clear that the efficiencies, from what I've seen, within county-based purchasing, as opposed to essentially a for-profit model of healthcare presented by the large Twin City firms, this really presents an existential threat to those organizations, and that's why they're fighting this so much. That's why they have allies over at DHS, and I'm hopeful that the lawsuit, I presume the joint powers voted to continue with the
Yes.
lawsuit, the appeal. Hopefully this will prevail because honestly, this single source model is the way to go. So.
Well, and we have a statute that clearly defines that, but, this is another way to ease our way into it. If we do prevail down the road, we're going to get in a little easier and get used to it, so to speak. And, it's clearly defined as statute. The judge that ruled, I think he thought, well, he didn't really present a specific statute that called for multiple. He just said, wouldn't it be fair if there were more people allowed to be in? And it's,
I would like just to share my feelings on this as well, and I think I'm in agreement exactly what you're saying. I'm supportive going this direction, but I'd like to frame this as that I view this as a win-win situation, and I really like win-win situations. We're going way back, but I feel this way. I think it's also good for the Blues, and I think we've gotten good service up from the Blues, and we can still have them involved with this process. We can see how it involves, and competition is good for everybody, as you were trying to say. And this is a good place to start. And besides, it's saving us a lot of, over a couple $1 million. So it's a good way to go. Commissioner Endek.
Yeah, you've answered all my questions very well, thank you, Ms. Lippert. But one of the observations is that Prime West does a better job of remunerating the providers than the major Blues and Medicares and UCares do. So that's good for our community providers. And regarding the costs that we may see moving forward for staffing, I guess we would have had to learn some of those other plans anyway that they've added to the mix. Maybe not 3 of them, in some cases 4 of them, but, so that's probably part of the cost of doing business, so.
Yep, and I would agree with that. One thing that I just wanted to also note, when you were talking about the influencing of health plans and who can do that, and you mentioned providers here, providers can influence. So that is something too I know Prime West has talked about, is building that rapport and connection with the providers right away, and we can see what that looks like. And the other thing regarding, depending on where the lawsuit goes, I know that this will be a hot topic item for legislation this coming year. I know our current legislators up at the Capitol, they are aware of this. I've been in communication with them through the whole entire process back when we had supposedly the 2018 and that got delayed, and we've been through this process here a number of years. So I anticipate that county-based purchasing will be on the docket for a legislative priority to come.
Okay. Any further questions or comments? Okay, so we made a motion, and this agreement is that we would pay these dollars by the end of May, I understand. And the agreement has been reviewed and approved by our county attorney. And
Just got to add an address.
yeah, got to add her address. That sounds good. Okay, no more comments? I'm going to call for the vote.
Oh,
Oh,
The motion and the second, and then just restate the motion.
can we,
Well, we'll try,
Commissioner
but
Nissen?
I moved that we go ahead and opt into Prime West via the promissory note that has been reviewed by our county attorney, and that would be my motion.
And seconded by Commissioner Emdek. Thank you for calling that to our attention. Appreciate it.
I hope that was clear.
You have one of the tougher jobs here today, I think. Okay, all right. Any further discussion? Hearing none, I'm going to call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Passed unanimously. Well, thank you, and very excellent presentation, and I'm just real excited that we've gotten to this point. We've been talking about this for a long time, and as I've heard Mr. Kleindl even mention that this is a no-brainer. I think it's a good way to go, but it's definitely a win-win situation. Thank you.
Thank you, and I hope to be back in front of you here in the next couple months as I can give updates as to what things are looking like with this decision and with Prime West entering into Candido County. Thank you.
Thank you.
Nice job. Nice
Yes.
presentation.
At this point, I'd like to call on Mr. Van Dyken, Candido County Zoning Administrator. Good morning. Eric?
Good morning. Thank you, Mr. Chair, members of the board. Eric Van Dyken, County Zoning Administrator, here with 3 different action item requests stemming from a Planning Commission meeting on November 7th. That'd be last week, Monday. These are all conditional use permit requests. The first is that of Generations Land LLC. This is a family company, the Litzow family, who was involved with, in particular, in large part, ag drainage. And they do some general excavating and sewage treatment systems, et cetera. But one of the main focuses of their business is ag drainage. They have purchased a property, and I'll illustrate it here for you.
For Eric. I'll zoom in here.
I probably should have spun it around, if I may.
One more.
There we go. That's perfect right there. So the road you see here is County Road 2. We're just north of State Highway 7 a little ways. If you're familiar with the old town of Thorpe, just north of there. One commissioner in particular probably familiar with that area, I understand. This parcel right here is the parcel in question, a 20-acre parcel. They would concentrate their shop and office in the northern part, and then they would end up having some equipment storage, material storage in particular, probably some tile that they may purchase that would be further south on the property. The Planning Commission did unanimously recommend approval with 5 attached conditions and the findings as you see in the minutes. Staff recommends that as well.
And that was Highway 7, the road right below it?
No, it's just
that'd be about another mile or so.
So it's
Mile and a
further
half,
up,
maybe.
okay.
Yeah, so the crossing to the north here is about 2 miles north of Highway 7.
Okay.
So
All right, thank you.
Mr. Chair, I would make a recommendation that we accept this proposal or this,
A motion by.
With facts and findings?
yep, with facts and findings. Sorry.
And conditions, yes.
I'll second that.
A motion by Commissioner Anderson, a second by Commissioner Nissen. Any further questions or comments? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously.
The next application is that of Zach Hardebeck. This property is located up in the Hillcrest area. This right here is State Highway 71. This is Hillcrest Truck Stop, and over here you have county landfill properties. The property in question is this property right here. It is zoned commercially, and Mr. Hardebeck proposes vehicle sales and service. He currently is in the process of constructing a shop in this area. Overall, here we have a fair amount of commercial now. One was approved here not that long ago. These properties are zoned commercially as well. And the Planning Commission does unanimously recommend approval of this request with 7 attached conditions and the findings as you see in the minutes.
Mr. Chair, I'd move on this conditional use permit with citing the findings and conditions.
A motion by Commissioner Index. Do I have a second?
I'll second.
Second by Commissioner Gardner. Any further discussion? I'll call for a vote. Before I do that, it looks like you had 7 conditions and 8 findings. Okay, I'll call for the question if there's no more discussion. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously.
Thank you. And the third and final recommendation is a recommendation regarding a proposed dog kennel operation. This is located in Mamre Township, Section 6. This is Old State 104, current highway, County Road 7. And 29 County Road is just a little north, 27 is a little ways south. This is the property in question, and more specifically, the building in question is right here, a little ways off the road. Their kennel run area is behind it. They breed some fairly small dogs, miniature Australian Shepherds, I believe is what they're called. And the Planning Commission also did unanimously recommend approval here with 3 attached conditions and findings as you see.
At this point, I'll entertain a motion.
I will move that we adopt that with the findings and facts.
A motion by Commissioner Nissen,
I'll second
a
that.
second by Commissioner Anderson. Any further discussion or comments?
Mr. Chair.
Commissioner Gardner.
Thank you, Mr. Chair. Being a dog dad of a couple of mini Aussie Cavalier Cross dogs, they can be relatively yappy and they're very high energy. I noticed that there was one neighbor worried about noise, but it appears as though they're about a third of a mile away from this property.
That is correct. The ordinance requires a 500-foot setback. The property in question that had some concerns is pushing 2,000 feet, so about 4 times the setback. A little hard to know exactly what they've historically experienced there. Some of the conditions are intended to address that, like closing of the outdoor run and exercise areas by 9 p.m., requiring dogs to be under staff control all the times in their indoor kennel areas or under control in exercise areas. So some of those conditions are intended to address some of that, but being quite a ways past the acceptable, or what the ordinance considers to be the acceptable setback, certainly does provide us with some additional comfort that the impact would not be perhaps significant.
And then just for a point of information, if I may, on our ordinances as they revolve around facilities like this, dog breeding operations. I was a little confused within the narrative here. They're talking about a maximum of 20 dogs, but we actually all allow more than that? And these are just the adult intact dogs?
So by ordinance, the limitation is 40 for operations like this. The reason why this is noted at 25 compared to 5 is that they have a handful of dogs that are not like breeding dogs, but just kind of family dogs. Those are just kind of run around like any old farm place that has some dogs on it. So that's why, in order to avoid a situation where they're breeding 20 and I come up and they got 2 family dogs and now I'm telling them, hey, you're over your limit, we put a little cushion there in that, but it's still well below what our ordinance maximum would potentially allow for a peak.
I think I would encourage us at some point in time to rethink that ordinance maximum. What we're seeing at the Humane Society, where we've already seen more animals in the first 10 months of this year than we saw all of last year come through the shelter. A lot of folks got pets during the pandemic, and now a lot of folks are turning those pets back in. I don't have an issue with ethically run breeding operations, but to me, there's no point in anybody being allowed to have an operation of that size of 40 animals at one time, and I would hope in the future that we would revisit that. I will be supporting this today, however.
Any further questions or comments?
Yep.
Commissioner Anderson?
My comment to that is, it does sound excessive, but at the same time, a lot of these people that breed these dogs, they'll take the dog back for a time until they can maybe find another home. If the people that purchase those dogs don't want them, or, after they've had them a while, they maybe decide this wasn't for me. So some of them will take it, because I know one individual that they do that sort of thing. So then they end up with a number of extra dogs for a time until they can find somebody else to take that pet home with them. So sometimes it does get a little higher than maybe.
I would-
Otherwise, they might all end up in the in a pet shelter somewhere. So.
Commissioner Anderson?
The dog I have currently was in that exact situation. The first buyer couldn't handle the little guy, my buddy.
Okay.
But so that went back to the breeder. The breeder happens to know my daughter's. The breeder's sister is a very good friend of my daughter, and that's how we ended up with that dog. But wouldn't trade him for the world. Once in a while I would, but so yeah. Do we have a motion already?
We have a motion and a second, and I just want to, before I call for the vote at this point, I just want to comment, Mr. Van Dyken, and the zoning planning committee, you run into a whole variety of situations, don't you? You have to have a lot of different rules and regulations. No more discussion from anyone at this point, then I'll call for the question. All in favor, say aye.
Aye.
Opposed, same sign. Passed unanimously. Thank you very much for bringing this forward. At this point, I'd like to call on Andy Thorson, Candioi County Facility Maintenance Director. Good morning, Andy.
Good morning, Mr. Chairman, members of the board. We're here today to open bids for the Human Services and Law Enforcement Heat Pump Project. I do have bid tabs here if anybody would care to keep track of.
Oh, sure.
Oh, shoot. Perfect. Thank you.
$20 fine.
Yeah. Well, just before you leave.
But hey, thanks for the reminder.
I think Gail called you.
Yeah, Commissioner-elect Anderson, yes. I saw him with his phone, yeah.
Let that be a lesson to you.
Okay, back to more serious business at this point. Please proceed with the opening of the bids.
All right, we did receive 2 bids, hoping for 3, but got 2, so we're happy with that.
Okay.
The first will be from Chapel Central from here in Wilmer.
Make sure their license is there. I'm assuming it is. Somebody, they got theirs in their own sign envelope.
Yep.
Background music or something here.
Where is?
That's inside today anyway.
Both addendums have been acknowledged. Bid bond is attached. And the base bid will be $2,146,000 even. That's 2,146,000 in no cents. The breakdown for individual buildings, Health and Human Services building will be $1,158,000 even. That's 1,158,000 in no cents. Total cost for the law enforcement center is $988,000 even. That's 988,000 and no cents.
May I add at this time that we are going to be opening the bids today, but we're going to award them the next meeting?
Yes, we will. We're going to be reviewing the engineer on record. We'll be going over them with a fine-tooth comb and be coming back to board on December 1st with recommendations.
Perfect.
The second bid is from Lake Country Mechanical in Spicer. The addendums have been acknowledged. The bid bond is included. And the base bid is $2,106,000 and no cents. That's 2,106,000 and no cents. Breakdown, total cost for Health and Human Services building is $1,106,000 and no cents. That's 1,106,000 and no cents. Total cost for the law enforcement center is $1 million even. So 1,000,000 and 0 cents.
Well, thank you, Mr. Thorson, and I really want to thank the two companies that did bid on this, and the county board appreciates that very much, and we also appreciate and we're excited to see that these are local contractors bidding on this. So this is a good deal for our county, and we appreciate the two businesses that did bid. Thank you.
Was there an engineer's estimate as to what?
Yeah, 1.8 million.
1.8 million.
Yep. Okay. That's it. Okay. Well, thank you very much for coming here, and we'll address this then at our next board meeting. Appreciate it very much. Okay, at this point, we will move on to administrator updates.
Thank you, Mr. Chair. Just want to announce, since the last board meeting, we did interview for the new IT director, Commissioner Gardner, Commissioner Berg, were involved in interviews. We interviewed and we have offered the position to Scott Hovland, and he has accepted. His starting date will be the 28th of November, and Jay's last date is December 9th, so we'll have a couple of weeks to have a transition and already started that process. I think you received an email from Sarah Swedberg regarding a meeting tonight. Ms. Brown is going to be talking about community development and small towns and rural areas. And so if you're not able to attend in person, you can do it from your home by a Zoom. So she sent out a link to that. But I think it's being held at PBS in Granite Falls and here at the Health and Human Service Building. The public is welcome to come and listen to it as well at 7 p.m. And just remind everybody, and the notice did go out to the media, the next board meeting is December 1st at 9 o'clock. Due to our annual AMC conference that's scheduled for December 6th. So our next meeting will be on a Thursday here in this room. We'll have the meeting, and then we'll recess, and then that evening, we'll reconvene at 6 p.m., and we'll open up the public hearing for the Truth and Taxation meeting. And after that hearing, the hearing will be closed, and we reconvene as the county board. Just so the public understands that Truth and Taxation meeting is not about your property value. It's not about when you get your proposed tax statement about what your valuation is. It has to do with the county budget. And so the meeting regarding your property value usually begins in March of each year. And so I don't want to waste your time. You're welcome to come if you want to talk about the budget, but if you're talking about your valuation of your property, that's at a different time. So I just want to make sure that's clarified, and wish there's a way we could have the public aware of that, because I know it's often cold those days, those evenings, and you come out, you're thinking you want to talk about your valuation, and that's not the intent of the meeting. The intent is to talk about certifying our levy and the budget. That's all I have, Mr. Chair.
Okay, thank you very much for the update.
I have a question. I'm a little confused about this evening's meeting. Are there two physical locations, one at Pioneer?
Yes. And you can also listen, if you can't attend this meeting in person tonight, you're at the Health and Human Service Building, there is a website, you can listen to it.
We just received notice, I think, 5 days ago or less, and it's, yeah, there's a lot of commitments already. I know I got commitments tonight.
Yeah.
So the one tonight, will the presenter be here, or will that be a Zoom meeting?
Zoom.
I got it.
They're not live. It's all virtual.
I'll be here.
Okay, thank you.
You're welcome.
Commissioner Gardner.
Thank you,
represent
Mr.
us.
Chair. Yeah, I'll be attending here. It's a presenter talking about revitalization of small towns, downtown areas, things like that, and what community-led efforts can do to assist in that. This isn't necessarily about what local governments can do. This is what about people can do. And so we're really looking forward to hearing this presentation tonight. They've worked all across the country with towns small and medium-sized to help advance economic development and small bets, making small bets on your community to make it a better place. So looking forward to it.
And again, if I may ask, Commissioner Gardner probably knows better. So these ideas for underused or unused spaces, they're not necessarily confined to, say, daycare or other community needs.
It's really
for private business.
Sure. It's really left up to the imagination of the community. It doesn't necessarily have to come from the business community, although it can. It can come from regular citizens. It can be something as simple as, I wish we had a nice little park over here, or I wish that we could make use of a vacant building. So maybe you work with some other entities to maybe just open it up once in a while for a couple of bands to come in or musicians to come in, have a place to play. It's about placemaking, about giving more vitality to your community. So really looking forward to it.
Okay. All right. Well, it's time. Any calendar additions at this point, or committees or announcements? Otherwise, we'll do our commissioner update. Commissioner Gardner, would you start, please?
Sure. Thank you, Mr. Chair. Had a meeting on the 4th with city staff, as I said, on the comprehensive land use plan task force. That group is beginning to wrap up their work, and it sounds like the City Council will be getting that, I would say probably after the first of the year. I would guess that the new council will be seeing that at that point in time. Supporting Hands Nurse Family Partnership, Joint Powers Board, we welcomed Nikki Prosch as our new executive director. One financial item of note, in 2022, our contribution to the partnership was just a little under $56,000, which had been reduced, you may recall, last year by around $14,000 or so. And that came out of reserves. Well, the Joint Powers Board voted to reduce the overall contributions by each county by another $100,000 out of those same reserves. So we will see a decrease of about $13,400 in what is levied to the to Candy, Ohio County in 2023. Sat in on another meeting of the Public Health Joint Leadership Team. That is the group that's comprised of members of representatives of SHAC and APHA and the Health Department. And we continue to work on essentially trying to figure out what the next iteration of public health looks like in the 21st century. Chaired the Candy, Ohio Renville Community Health Board meeting last week, and I will be vice chair next year. We changed our bylaws earlier in the year so that over the next 2 years, the chair will be from Renville County, and then 2 years after that, the chair will be from Candy, Ohio County. I will be vice chair again, and I will also be the SHAC representative. That's the State Community Health Services Advisory Committee, and that's what gives me the membership on the, allows me to continue the membership on the Joint Leadership Team. I was also...
Good to have representation on that. That's great.
And I was also asked to run for SHAC Vice Chair. So I've allowed my name to be placed in nomination on that, and we'll see how that goes. The decision on that will be made at the in-person SHAC meeting in St. Paul. I believe it's December 16th. And so we'll await the decision of the membership at that time. And that's all I have.
Thank you for the update. Commissioner Nissen.
Okay, well, I think 2 meetings with Prime West in the first week of the month. The one was a direct meeting between, I believe, Corky and Larry, and I'm not even sure if I made that meeting because pretty close to bus driving time. But anyway.
Oh yes, right. There was a meeting before.
There was a
Oh, you got
second.
something in it, yes.
The second meeting was the regular meeting in Alexandria, where everyone was invited, and a number of our commissioners were probably online. I think Roger was there and Corky was there. Dwayne was there, but were you there?
And
I
Mr.
was.
Pindall was on line too, yes.
So we had a good discussion about most of what you heard today. So I won't go on and on about that, but we did decide to appeal the decision of the judge regarding the statute that he ruled against us on. More to come on that. I also had a meeting with the next week, on the 4th of November, with a group that none of you have actually heard of before. It's Candy, Ohio County Mental Health Local Advisory Council, which is, I think we might have met 3 times this year. They talk about a lot of things. The suicide Out of the Darkness fundraiser, a lot of different things. Various people in the community sit on the board. I think there was some folks from our Health and Human Services people. There was a fellow that is the director of the Out of the Darkness thing, myself, and April Peterson. She works in the building here, I believe. But and we just talk generally about how we're working towards some of the issues that face us in the mental health field. The Broadband Committee met last Monday, and sadly, we have not heard yet about whether we've been awarded the for the broadband in my district. We talked about some of the other things that have been worked on and approved and are done in some cases. So we're making some progress slowly, like a baby's first steps, it seems like sometimes, but hopefully we'll get that award for Arctander and Mamre in Dovry Township. But they said in the fall, well, it's getting close to winter now. In fact, all you have to do is look outside and winter is here. But according to the calendar, they still got until December 21st, I guess. So we'll continue to wait for that decision. And then the Highway 23 Coalition met at the EDC. It wasn't the legislative, it was a meeting to decide maybe what projects we want to endorse. And one of them we talked seriously about was the bypass, or I don't know if that's the correct term, the situation with Highway 23 and County Road 9, is it? Highway 9. And then there's also County Road 40 in there. And most people thought that was a worthwhile project, and it will move forward with to the next general meeting to decide whether that's going to be one of our priorities. And Mel, if I missed anything on that, I think that's kind of where we were at on that. So that's all I have.
Okay, thank you.
Yep.
Mr. Anderson.
Okay, yeah, so I had a few meetings as well. I met with Canada County Traffic Education Safety Team. It had been kind of not meeting for probably over a year since Stephanie Felt had taken her new position and as emergency management director. But anyway, so we met and then we talked about road safety in the area and different types of safety, which is there's a safety awareness that program that they have going on, which shows what distracted driving can do and accidents people can get into, and then they go around to the different schools or discussing about potentially going to different schools as well. And then one of the items that was talked about, kind of was just brought up, was about the different accidents in my district, which would be Highway 40 and County Road 7, Highway 40, County Road 1, and Highway 7 and County Road 2. I think I said them right. And anyway, but we are working on it, and we did, I believe, install some rumble strips on Highway 4. Well, it wouldn't be Highway 4, County Road 7 by Highway 40. That intersection where there was a couple deaths this year. And we're continually working with the state and different government entities to get others installed as well, or solve the problem with those issues. Let's see. Then I also attended that Prime West meeting where we talked about what's all going on with that, and the need for maybe being enrolled in with or joining in with Prime West. And but everybody else has been there, so I won't go into that. On the 3rd, I went to the Bloomkist Community Center in Bloomkist, Minnesota, where we had a meeting about, or it wasn't really a meeting, it was just open house for the County Road 44 project south of Highway 7. And it's going to be a rebuild of that about a 3-mile stretch, I would say. 2.5. Yeah, 2.5 or whatever. So that's real good. I take that road once in a while to get down to Olivia, and it was needed. It's just too bad that Renville County isn't going to go do the same thing. Maybe they will in the future after they see how good our road will be. So after that, let's see, what else did I see? I think that's about it.
I forgot that one.
I was going to say, Margaret Johnson, she called me and she wanted to set up kind of a meet and greet type of meeting with the county commissioners and the Soil and Water Conservation District. And she decided to go with the Handlebar Restaurant in Atwater. And it's going to be on the 30th of November. It's a Wednesday, and it'll be from 3:30 to 5 o'clock. And she's going to have pulled pork sandwiches and appetizers there, and it's a nice little bar and restaurant, and hopefully the rest of the commissioners can come and meet Margaret Johnson and the other Soil and Water Conservation District individuals.
Okay, thank you, Commissioner Anderson. Commissioner Emdek.
Thank you, Mr. Chair. On November 1st, we had the One Watershed, One Plan meeting in Litchfield, the policy committee meeting. It was largely a presentation, and Mel can help me out. What's the big engineering firm in Mankato that does a lot of water work?
Molten Bank?
No.
Start with H. Houston? No.
Yeah, well, anyways, they do a lot of work with watersheds
Houston.
and drainage. And one of the big conversations was keeping water on the land during big rainfall events, keeping it on the land for a few days and work. They've done quite a bit of work with projects that have allowed that to happen so it doesn't rush down the rivers and ditches and create a lot of, it was really pretty interesting meeting. Then on 11/3, like all of you, I was at the West meeting. On 11/7, we had the EDC Broadband Committee, that meeting that Raleigh referenced earlier. On November 9th, I went to the Transportation Alliance meeting. It was our annual meeting, so awards were presented to different people regarding their work advocacy for transportation. And then there was also a presentation again on infrastructure investment in Infrastructure and Jobs Act and opportunities there. And then when let's see, that evening we had Middle Fork Watershed District meeting, and they have hired a new administrator there, a guy with the name of Dan Coughlin. I didn't really get an opportunity to visit with him, but we'll be meeting him pretty soon. And then on 11/14, no, that's, oh yeah, yesterday, today's the 15th. I had a post-election call with Chuck Ackman, who was an aide for Senator Klobuchar. He had asked me to give him a call after the election. We talked primarily about what the potential is, given the results of the election, for continued CDS, community or congressionally directed spending. Still be up in the air, but hopefully there's enough support to continue that, because I think a lot of legislators felt like that's been a helpful program. But I want to just touch a little bit on what Commissioner Nissen said regarding the Highway 23 Alliance and their support of the interchange at Highway 23 and 9. So as everybody might expect, to do a modified interchange is going to be a heavy lift in regards to financing that. If it's possible for it to happen, it's going to take some time. It will also take some time for MnDOT. So the two options that have emerged as possibilities are a roundabout and then a modified interchange. And I can see by the expression on some people's faces here, the enthusiasm for the roundabout is fairly low, and the community feels strongly about a modified interchange over there. So one of the things we have to be aware of is that either plan is going to take some time for design and recognizing where the funding might come from. In fact, we have a meeting later in about an hour and a half or 2 hours about that. And so one of the things that we might consider is it possible to suggest that we kind of do this in a parallel way? So rather than wait 2 to 3 years to find out if we find funding, the appropriate funding for an interchange, and then start the process for the, second choice, a distant second choice of a roundabout, what would happen if they would start, and I can't speak for MnDOT, but we can certainly bring it up. What would happen if they would start the process of designing and doing the study for a roundabout? By the time they would have that funding and have that, we would probably have a pretty good handle on whether or not we're going to identify some funding sources for an interchange. And this is going to be largely on our state legislators about putting a bond in for bridges. And we also have to continue to explore the opportunities within the Investment in Infrastructure and Jobs Act, what might be out there. So anyway, probably more to come. I think MnDOT, Mel, aren't they going to be addressing us next month or in December?
Soon. They haven't picked a date.
Yep. So that's all I have.
Okay, thank you very much. I had at least 2 meetings and several other individual meetings concerning Prime West as well with Southern Prairie Community Care, talking to one of the commissioners there. I attended the meeting in person with Commissioner Nissen. He's the appointee from the Candioi County, and I was the alternate, and it was a very good meeting, and it actually takes practically a whole day by the time you drive up there, and that was a long meeting. They cover a lot. And that's a very huge board, huge in many aspects, you know, not just the numbers of the commissioners involved, but also all that they do. It's a big company. As was mentioned, I attended the IT interviews, and we were excited about the hire for that. I had a meeting with Representative Dave Baker and Dr. Holly Booth concerning Prairie Lakes Youth Program and the bonding that we did get there before, but we, you know, because of COVID and so forth and the costs, and it's not enough to do anything, but we did some preliminary talking that is still find out and talking about what are the needs of Southern Prairie Community Care Program. PAC4 meeting that same day, and I won't really talk too much. You already heard a lot about PAC4, but PAC4's got a lot going on and a lot of changes taking place. And Bob Fox is the current chair, and he's going to be going off the board too. So we're going to lose 2 important people as part of PAC4. I had a library meeting yesterday, and just to update everybody that the law library, we contracted with the Minnesota State Law Library Association, and they do reviews of your program. And for really a very small amount of money, they came out here and gave us a review and was here 2 days and really came up with some good suggestions what to do with the program, and went through a lot of the material that we have, which was what is current and what is outdated. And they have some ideas about negotiations with especially Westlaw services and stuff like that, how to proceed. So it was a very good meeting. We were going to review our bylaws. We haven't been reviewed for a very, very long time, let's put it that way. And we're going to proceed with that as soon as possible. At this point, I'd also like to give a shout out to the Candioi County election process and to our staff, Mark and Tom and everybody else involved, and they're still working on it, and all the volunteers and paid staff that were involved in this whole election process in Candioi County. I feel it was really quite a success when we listened to the news that I think it took us about 2.5 hours to get all our election results finished, which we want to do it as fast as we can. State of California is still trying to tally numbers. So we have a good system here, and it sounds like things went off without a hitch, but also to thank all those volunteers that are election judges. This was an extra hard year, what I've heard, for them. The extra training because of concerns about the election, and you know, we all know in the media what the concerns would be. And it's very time consuming, a lot of work for them, and they make our system, our democracy work. And, you know, thank you goes out to all of them involved as well. So we had a good system. And Commissioner Gardner?
Just to note that tomorrow, Commissioner Imdek and I will be a part of the canvassing board going over and certifying the election results tomorrow.
Okay, thank you. Anything further, commissioners, at this point? Hearing none, I'll hereby adjourn the meeting.